I don't think that there's any woman of age who doesn't know or is not aware of what breast cancer is, but I can guarantee you that many women are not aware of how to prevent breast cancer. So that's what we're all about here. And joining us will be Dr. Bill Amalu from California and Rebecca Reverie from the Safe Breast Scan organization. And joining us by phone from New Hampshire is Rebecca Reverie, a certified thermography technician. Welcome, Rebecca.
Hi, Dr. Joyce.
Hi, how are you today? Thanks for being here.
I'm well, thank you.
Good. Listen, I want you to first define thermography. We are saying you all thermography, Thermo, graphy, thermography. Tell us all about it, Rebecca.
Thermography is radiation-free breast health. So we can see things changing in the breasts at a very early stage. There's no radiation, there's no pain, there's no compression.
Okay. Hello?
Yes?
Okay. You said there's no compression, and what else?
There's no compression, there's no pain, and there's no radiation.
All right. You said something very interesting. You said you can see things in the breast very early. Say more.
We can see vascular patterns, and it senses heat. So we can see changes occurring before they are lumps that are large enough to be felt.
Oh, okay. So you're saying that a lump forming that cannot be felt yet can be detected with a thermography because a thermography is a heat scan. Am I right?
Correct. So we can see things brewing and changing before it's something that could actually be large enough to be felt or biopsied. So it's the gift of time. It tells you that, there are changes in the breast, and that you need to maybe make some changes in your lifestyle or your diet and move things in a positive direction. We can also see things that might be, able to be felt, and, we can see if it's good or bad.
Okay. Interesting. I love this whole concept. Your website states that you provide women valuable information about their breast health only available through thermography. Why is that?
Well, because all of the tests that we now have for breast health look at the breast differently. So thermography looks at it differently than mammography, and mammography looks at it differently than ultrasound. And none of the tests are a replacement for the other tests.
Okay.
They're best used if you get the best picture of your breast health by using all three when necessary.
Okay. Interesting. Thank you for that clarification. And how long has thermography been a diagnostic tool?
Thermography has been a diagnostic tool for many, many years. Back into the 70s, it was FDA cleared.
Oh, it's in the 70s?
Yes.
Really? How come it's not more widely used?
Well, in our country, thermography is not the standard of care.
Okay.
Mammography is. So it is widely used in other countries, and it is catching on here. But, it's generally not paid for by insurance. So it's, a service that women pay for themselves when they're taking their health into their own hands and doing something for themselves for their own breast health.
True. Yes, that's just like taking your monthly checkup when you self-check yourself monthly. You're taking that into your own hands as well.
Absolutely.
Absolutely. Now, breast thermography works. You said it is a scan. It's a heat scan. Is it also synonymous with being infrared?
It is infrared.
Oh, okay. Tell us.
Infrared camera.
How does it work?
Well, I think that would be a question better answered by Dr. Bill.
Okay, well, on the line, we've got Dr. Bill Amalu, who interprets all of the scans that Rebecca does, and he is actually a chiropractic doctor out of the Pacific Chiropractic and Research Center in Redwood, California. And Dr. Amalu brings over 23 years of thermal imaging experience to patient care. Welcome, Dr. Bill.
Thank you for having me.
It's my pleasure. So, I was just asking Rebecca how breast thermography works in terms of it being infrared, and she deferred that to you. Please enlighten us.
Well, no problem. The technology uses a very, very sensitive infrared camera mated to a computer, which uses post-imaging software to create a sophisticated image of the surface of the body.
Mm-hmm.
It's the heat, it's the energy coming off the surface of the body that we're looking at,
Mm-hmm.
which differs greatly from other technologies, which are more structural imaging technologies. Things that your listeners may be accustomed to, like mammogram, CT, MRI, ultrasound, where you're looking inside the body at
Mm-hmm.
the tissues and organs themselves. What we're exploiting are the chemical changes that occur in the breast far in advance of a large mass of cells.
Mm-hmm.
The average discovery time at this point is a lesion approximately 1 centimeter in diameter,
Mm-hmm.
the size of a dime.
Wow.
It takes approximately 8 to 10 years for the average tumor to grow to that size.
Okay.
And in order to maintain the growth of the cells, the multiplication and the metabolism of these cells, they need an ongoing blood supply. It's called malignant neoangiogenesis,
Oh, my.
where the cells are sending out chemical factors in the breast to hold open blood vessels, to constantly feed, to bring in oxygen and nutrients, and remove waste. That's what we are seeing,
Yes.
that neoangiogenesis.
My goodness. You know, it's interesting, Dr. Amalu, when I introduced you, you're a chiropractic doctor. And on this show, we just introduced the first traditional chiropractor to this audience a few weeks ago. And the scope of what chiropractors can do is so broad. And I'm sure this audience wants to know, how does a chiropractor know about breast scans and anomalies? Talk to me. How'd you get involved?
Well, let's see. Where should I start? Basically, in the United States, we're a primary care physician's portal of entry. So we're very much like a primary care physician, but of course we don't lance the skin and we do not prescribe medication.
Mm-hmm.
So within that vein, if we talk about medicine, if you want to specialize in radiology, you become a radiologist. In chiropractic, if you want to be a chiropractic radiologist, you specialize in radiology.
Okay.
If you want to do what we do, we specialize in thermology, and that's why I'm a board-certified clinical thermologist.
Aha.
So it's specialized training in order to do this. I hold 3 board certifications.
Mm-hmm. Well, fantastic. I just wanted that clarification because as a naturopath, I'm quite familiar, but I wanted that explained to the audience because chiropractic has specialties, and I'm glad you were able to explain that. Thank you so much. Now, does breast thermography replace mammography?
Absolutely not.
Okay.
Does mammography replace thermography? Absolutely not.
Okay.
Again, the technologies are complementary.
Yes.
One helps the other
Mm-hmm.
because of the advanced warning, the possibilities, because, again, thermographies are risk assessment tools, the best way to put it. It uses the woman's individual biology to say, well, where's your risk? Is there a risk here that we're seeing that something might be down the road or something right now?
Okay.
So basically, they're very different. The technologies are adjunctive. They've added together.
Yes.
For instance, mammography does not work in a vacuum.
Yes.
Every doctor knows you still come in for your yearly physical examination of the breast. And your listeners might be saying, well, if mammography is so good on its own, why do I need a physical examination of my breast?
Mm-hmm.
Because all doctors know that a certain percentage of cancers will be found on digital palpation and not seen on a mammogram just because of the limitations of the technologies.
Okay.
They just might not see it. The cells of the cancer may look just like the surrounding tissue.
Uh-huh.
No fault of its own. That's just the limitation of the technology.
Understood.
So you're adding things. Everything's adjunctive, and what we're promoting is what's known as a multimodal approach.
I like it.
Adding thermography will definitely improve the capability of early detection.
Okay. All right. So it's a multimodal approach. I love that language.
Sure.
Fantastic. Now, Rebecca, how did you become interested in thermography?
Well, I actually became interested because my mother was diagnosed with breast cancer, and through her course of treatment, she wanted to track her progress, and she chose to use thermography as a tool, and she had to drive very far to do it. So we found that there was a need, and we actually went to school together for thermography. She was 75 at the time.
Wow. That's incredible.
Yeah. And we actually were trained by Dr. Bell.
Wonderful. That's a beautiful story. I love that. You know, I went to have a thermography done. I got a script from my medical doctor, my OBGYN, to have a thermography. So I called up my local breast center and I asked first, do you have thermography? Oh, yes. What day would you like to come in? So I made the appointment. The day I get there, I hand in my script and the receptionist takes it. And then when I am heading to the back, you know, and they usher you in, and you're half naked and you have on just a cloak. And so the nurse is pushing me toward a mammography machine, and I stop. And I said, you know, I am here to have a thermography, THER-mography. And she said, oh, we don't do those here. And I said, you know, I've had this appointment for weeks. What do you mean you don't do them here? She said, no, we don't do them here. And those things don't work anyway. So while you're here, and then she pushed me toward the mammography machine. And let me tell you, I almost had a fight in that place that day because I had to be my own best advocate because, you know, here you are standing half naked. And, you know, saying, well, while you're here, and pushing you towards something and trying to convince me that a thermography does not work. Now, I didn't go in there announcing who I am because I feel that I should be able to do some things anonymously, and getting a breast thermography is one of them. But I was so angry when I snatched my paperwork from this woman. She understood very clearly after that I was from the south side of Chicago, and it really wasn't so cute, but it was necessary to get my point across. So it took me a couple of days to simmer down. And I tell this story because we have to take our health into our own hands. And when I contacted that manager in my official capacity as a doctor in the Pocono community, and what I had experienced in their center, she was furious. And she tracked my phone call from the first day I called to speak with the receptionist to make an appointment for thermography, and that person being the person who was at fault for telling me that they do something that they don't. So, doctor, I would like to ask you, what do you say to an establishment or to other doctors who poo-poo thermography?
Well, it's actually a pretty easy answer, and that's the literature. Well, you know, we're not standing here saying that we have something that's experimental. You know, HEW released a statement in 1972 that said thermography was well beyond the investigational point.
Okay.
In 1984, the FDA cleared the technology as an adjunct for breast screening. So we're looking at well over 300,000 women participants in a lot of studies showing the efficacy of this technology. I got into this in a similar way as you know, a lot of other people in this technology.
Okay.
My sister died of breast cancer.
Oh,
she had done everything her doctors told her to do. She was 44 when the diagnosis came down.
Okay.
She had gone in every year at that time to have her mammograms and her yearly exams.
Yes.
She lived in a medical community, which means, of course, that we've got a university that teaches medicine and the hospitals and healthcare. This is not out in the middle of nowhere.
Yes.
The tumor grew so large that it changed the surface of the skin. They told her, don't worry about it. You've had all your tests. Leave it alone. This is probably just a cyst.
Oh, my.
And so mammography had failed because, again, of just the limitations of technology in that breast. And she had to have a mastectomy.
Oh.
And then when cancer appeared in the second breast, mammography blew it again.
Ah.
Now, we're not here to bash mammography
That's right.
or any other technology.
Mm-hmm.
Everything has its own limitations.
Mm-hmm.
Thermography is 90% sensitive and 90% specific. So that means that in a general population, the technology will detect an abnormality that turns out to be cancer 90% of the time,
Okay.
which is better than mammography, but they are completely different.
Okay.
And again, nothing's 100%. And when this happened to my sister, this is when it woke me up that we need to do something for the community. We need to add things. We need to and again, this is what's being done right now. I don't know where you are, but around here, ultrasound is used a lot of the time. A woman
Sure.
will go in for a mammogram, and they'll go, and then they'll add an ultrasound.
Right.
Now, by that time, the doctor's already examined the breast. That's one.
Mm-hmm.
Then we have a mammogram, two. Now we have three technologies added together in order to be safe and do what's right for the patient. And these are all good things.
Yes, yes.
But when you add thermography, it shows that survival rates go way up. And that's, again, just out of the literature.
Okay. Okay. I like it very much. I do. Now, when you have a thermography done, how long does it take to receive the results?
Well, there's different ways of doing this. If for instance, if a doctor sends a patient in and there's a mass or something else that's suspicious, we expedite reports same day, 24, 48-hour turnaround type situations.
Okay.
But usually most patients who are just coming in for their yearly exams, they get their reports back in about 2 weeks.
And that's the other thing. Should you have a thermography annually?
Oh, absolutely.
Okay.
Absolutely. And again, it can't hurt you.
Yes.
There's nothing. It's a sensor.
Okay.
Nothing comes out the human body. It's the actual heat coming off the body that goes into the camera.
Okay. One last thing before we go to break. Can you do a scan of the entire body to detect for such anomalies?
For a different reason, not for cancer.
Oh, okay.
No. For other reasons, yes. We do body imaging a lot for pain conditions, pain management, and sports specialties especially.
Really? Like what?
Well, looking at overtraining syndromes, looking at recuperation possibilities, post-surgical or post-injury management to see if the player should be back on the field yet, if there's residual inflammation. Things like that.
All right. Well, don't go away. We're going to take a quick break. Welcome back to Ask the Good Doctor on Urban View, Channel 126. I'm Dr. Lajoyce Brookshire, and it is Breast Health Prevention Month here on the show. Joining us by phone from New Hampshire is Reverie, a certified thermology technician, and Dr. Bill from California. He is a board-certified thermal image interpreter. Now, Lavender Lady from Twitter asks, what age do you recommend getting a thermography?
Well, we recommend starting at age 20. We're looking at approximately 15% of breast cancers now occurring in women under the age of 49.
Yes.
And as you are younger, like it was with my sister, a lot of these tumors are far more aggressive.
Yes.
So we recommend a baseline at 20 and about every 3 years to the age of 30 and then yearly afterwards.
Okay. All right. And Trina from my website wants to know, is a thermography FDA approved? And Rebecca answered that. You said since the 70s, right?
I think I may have given the wrong date on that. Dr. Bill said since 84, I believe. Is that correct?
Okay.
Yeah.
That's still a long time.
No
now,
problem.
I want to talk more about when an abnormality is discovered. You know, this is exactly when a naturopathic doctor should get involved. There needs to be lifestyle changes made there with food, with things with the mind, with the body, and the spirit. Toxic relationships need to go, and all things that cause stress need to go. Doc?
Well, yes. Again, it depends on what the findings are. I mean, if we're looking at something, we grade the images TH1 through TH5.
Okay.
TH stands for thermobiological grading. When we get to the 3s and up, 3 is questionable, 4 is abnormal, and 5 is very abnormal.
Okay.
We want to back that up right away with structural imaging. The
Yes.
patient is sent back to their doctor right away. We need to have more imaging to rule out anything right now.
Okay.
If nothing is found, then absolutely lifestyle factors.
Mm-hmm.
One of the things we haven't discussed is something extremely important with this technology.
Tell me.
Currently, right now, we're looking at the single greatest cause for breast cancer known is lifetime exposure to estrogen
Yes.
imbalanced.
Yes.
And how can we tell if the breast is under this condition? Thermography can really open your eyes to this possibility.
Say it.
Because we're looking at the metabolism of the breast itself, we can really warn of this type of condition.
Wow.
The current research says that the breast can actually have up to 50 times the estrogen in it that can be found in the saliva, urine, or the blood. Because we're looking at that the breast is an epicrine gland. We're looking at this primitive skin gland that can make its own estrogen. And also, of course, use the circulating estrogens that are there. And when estrogen is broken down or aromatized, metabolized in the breast, the byproduct is carcinogenic.
Yes.
And if we can warn a woman that their breasts have an estrogen predominance, this is prevention at its best.
Yes, it is. What can be done, Doc? What should be done?
Well, it all depends. We send the patient back to their primary care or whoever their doctor is to find the cause. Are we looking at it coming from the breast? Are we looking at the fact that it's not being broken down in the liver? In other words, go after where it is and then target that problem. And then we can actually watch the breast again with thermography. Again, we're going back to the doctor. Let's confirm the condition is there, number one.
Yes.
Work it up, find the cause, and then get at it.
That's it. I like it. Get at it. Get at it.
You bet.
I like it. Eradicate it. Definitely. Now, what do you feel, in addition to the estrogen, tell me what your thoughts are on inflammatory breast issues.
Well, I mean, do you mean inflammatory breast cancer?
Inflammatory breast cancer, yes.
Oh, boy. Well, thank goodness it's not too common. That's one that can elude a lot of other testing because it's a very fast condition.
Yes.
But with thermography, we can catch it. Again, using this technology together with other things.
Okay. And inflammatory breast cancer is one of them.
Oh, yeah. Well, again, because it's inflammatory, we're looking at producing a lot of angiogenesis, a lot of heat coming from a lot of blood being circulated to the entire breast.
Okay. Awesome. That's fantastic. Well, I want all of you to know that Rebecca will be coming to my wellness center, Wellspring Holistic Center in the Poconos, for a thermography day. It will be on Saturday, October 20th, all day. If you would like to obtain a scan, jump in your car, come on, drive up to the Poconos and enjoy all of the fall foliage, and join us on Saturday, October 20th. Send me an email at askthegooddoctor@msn.com for details on how to reserve your spot. Rebecca, tell us, what can you expect at their thermography appointment?
The thermography appointment is really very simple, very easy. It's a half-hour appointment, and the client will come with her paperwork filled out that she will receive ahead of time. We'll go over that paperwork and make sure everything is correct. And then you need to disrobe from the waist up and acclimate to the temperature of the room for 15 minutes. So the body needs to, not be holding in heat from clothing, so everything should be acclimated. And after that, we take a series of images, generally 5 to 10 images, and that takes approximately 5 minutes, and that's it. That's the whole appointment.
Awesome. And we'll be doing that all day. And then what happens with the scans that you have taken? The next steps?
The scans are then uploaded through a secure website, and they go out to California where Dr. Bill is, and he reads them, formulates a report, and the information is sent back to me through a secure website, and then the report is mailed to the patient.
Okay.
So it's their report that they can share with their doctor or whoever they're working with, and it's their information.
Okay. All right. And Dr. Bill, if there are no anomalies found, and if a doctor still wants to recommend that a patient receive a mammogram, what do you say to that?
Well, when it comes to the patient's health, we certainly leave it up to their primary care physician.
Okay.
It all depends on, there's so many factors here. If we're looking at a genetic background, we're looking at a lot of different risk factors, and of course, their health condition. It's whatever their doctor wants to do. If it were up to me, I would love to be able to use just MRI. I would go to the top.
Oh, okay.
And go for that kind of accuracy when it comes to structural imaging. That would be my preference. I think the American Cancer Society right now, as I believe on their website, advocates that if you're one of the high-risk patients, that MRI actually be added every year to your screening. So, when it comes to the structural stuff, I would prefer to go right to the top.
Okay. Okay, fair enough. Fair enough. Dr. Bill, what is your website? How can people reach you?
Well, if you type in breast thermography on every search engine, we're number one. We've been out here a long time. It's breastthermography.com.
Okay. Breastthermography.com will put you in touch with Dr. Bill Amalu in California. And Rebecca, your website?
My website is safebreastscan.com.
safebreastscan.com. And don't worry, we're going to put these things up. I want to thank both of you for joining us. This has been a mighty education for this audience today to have introduced something that perhaps they never heard before. And that's what we're all about here at the Good Doctor Show. So thank you for being here.
You're welcome.
Absolutely. Thanks for having me.